Infrared saunas or dry saunas. The risk isn't the air temperature around you. It's your internal body temperature rising to 39 degrees and staying there. That threshold matters because above it we see associations with neural tube defects, particularly in the first trimester when development is most critical. Dry saunas run hot, typically 70 to 90 degrees air temperature. But in a large systematic review, pregnant women sitting in a 70-degree dry sauna for up to 20 minutes did not exceed a core body temperature of 39 degrees. That's reassuring, but it's also really important context because the existing research on saunas in pregnancy specifically focused on dry Finnish style saunas, not infrared. Infrared saunas operate at much lower temperatures, usually 40 to 60 degrees. They heat your body directly using light waves that penetrate about 3 to 4 centimeters into your tissue, rather than heating the air around you. Despite that lower air temperature, infrared saunas still substantially raise your core temperature and cause heavy sweating. The one study that compared the two types side by side found that infrared saunas produce less cardiovascular stress, about 29% lower heart rate, but they tested them at the same temperature, and they didn't measure core temperature at all. A separate trial in healthy, non-pregnant women did measure core body temperature with infrared saunas and found it rose by just 1 degree above baseline, more than what moderate exercise produced in the same study. But here's the thing. No study has measured core temperature during infrared sauna use in pregnant women. So the assumption that infrared is automatically safer, that's not based on data, that's based on how it feels. Here's my honest take. If you want to use dry sauna during pregnancy, we actually have some data there. Short sessions, well within that core temp threshold, with your clinician's approval. Infrared, we just don't have the same evidence base. If you want to avoid intense heat stress, but still enjoy some sauna experience, infrared at lower temperatures is likely the lower stimulus option. Just know that it hasn't been studied the way that traditional saunas have. In both cases, if you feel dizzy, nauseous, your heart's pounding, know to stop, cool down, and hydrate.